This program is a collaborative effort of Sit and Be Fit, Stanford University Medical Center's Trauma and Emergency Services, Sequoia Hospital, and the San Mateo County Fall Prevention Task Force. Special funding provided by Stanford University Medical Center, San Mateo County Aging and Adult Services, and Catholic Healthcare West's Community Grants Program.
Sit and Be Fit is a tone and stretch exercise program designed to strengthen muscles and improve joint flexibility. Not all exercises are suitable for everyone. Consult your doctor before beginning this exercise program. Our instructions and advice are in no way intended as a substitute for medical counseling. Sit and Be Fit is a creation of Marianne Wilson, lecturer, teacher, and recognized leader in the field of senior fitness. Along with her ongoing research and background as a registered nurse, Marianne consults with a team of physical therapists and exercise specialists to bring you a fun and effective way to maintain functional fitness.
I'm Marianne Wilson. Thank you for joining us. The exercise program you are about to do is effective for any age, but it is especially designed for anyone needing slow, gentle movement. Now, get ready to sit and be fit. Hi, I'm Marianne Wilson. Welcome to the Balance and Fall Prevention Beginning Level Workout. Today we'll be focusing on exercises to help prevent falls. You can reduce the risk of falling and improve your balance by incorporating certain exercises into your daily routine. You'll see the greatest improvement if you practice your favorite exercises throughout the day. Before we begin our workout, let's review some important guidelines. You'll need a stable chair without wheels that won't move when you exercise. Choose a chair that allows your feet to rest flat on the floor, and use a chair without arms unless you're feeling unsteady and need armrests for stability. Place your chair directly in front of the television so you can see and hear me without twisting any part of your body. If you feel unsteady, hold onto your chair, widen your feet, and focus your eyes forward. Try doing the movements more slowly, and don't worry about keeping the exact time with me. Work at your own pace and listen to your body. You can do as much or as little of this workout as you feel up to. And if you're just beginning to exercise, take it slow. And with practice, you'll be able to do most, if not all, of the exercises. And most importantly, don't do anything that causes pain. If you do experience pain or excessive dizziness, please check with your doctor before continuing. Now, let's get started. Good posture and proper breathing are the most important exercises you can do and should be practiced throughout the entire workout. So let's get into good posture by sitting up tall. Your feet are flat on the floor, hip width apart, and your weight is evenly distributed over both feet. Now tuck that tailbone under and your tummy in and lift your chest, relax your shoulders. You want to gently squeeze the shoulder blades together. Imagine someone pulling a string attached to the top of your head. Now, take a deep breath in through your nose and slowly breathe out through your lips. Now that you know what good posture looks and feels like, let's do some exercises to make it easier to keep that good posture throughout your day. Sit up tall, take a deep breath in through your nose, breathe out through your lips. We're going to put one hand here, right by your collarbone, and the other here. And now lift up your chest. I want you to hold it there. And now we're going to relax just the hands, not your rib cage. We'll do it again. Put one hand here, one hand here. Give a good lift. See if you can lift any higher. Hold it there. And now relax your hands again. We're going to do that 2 more times. Hands are here, the chest is lifted, you're holding, and now slowly turn your head so that you look to the side, and then come back to center. Relax. Let's do it 1 more time. Lift, hold it, and now slowly turn your head. Look to the side, and now look straight ahead. Now let's get the neck in good alignment. Just touch your chin with your hand. Pull it straight back. I want you to hold that and just relax your hands again. Touch again. See if you can pull back just a little bit more. I want you to feel that stretch right back here in the back of your neck. Relax your hands again. We're going to do that 2 more times. Touch, see if it will go back a bit more. And now this time, turn. Let your hand turn your head, and then allow it to turn it to face forward. Do it again. Touch, pull back, and turn in this direction, and then straight ahead. Good job. Now let's get the shoulders down. Push. You want to turn your palms up and reach back, roll your shoulders back, and let's squeeze those shoulder blades. Do it again. Press. Get the shoulders down. And then turn your palms up, reach to the back, and squeeze your shoulder blades again. We're going to do it again. Press as though you're pushing the floor away from you. Turn your palms up, reach to the back, squeeze those shoulder blades, and one last time. Press. 2, 3, 4. Palms are up, you're reaching back, chest is lifted, and now relax. Let's reach out for an imaginary tray. Bring it halfway in, and now reach out for it again. Pull it all the way back. Reach for it again. Pull all the way back, and this time, see if you can touch your elbows to the back of your chair. One more time, all the way, elbows touch, and the shoulder blades squeeze. Let's do that whole set again. All the way back, touch those elbows, squeeze the shoulder blades, and again, reach, touch, and squeeze. Put your hands together. Let's take a big breath in through the nose, slowly out through the lips, and relax. Wonderful. Now our next routine will be working on head-eye coordination. This is important for balance. Stop if you feel dizzy. Okay, sit up tall, keep that good posture, and lift up your toes, hold it, and then tap it twice. Lift the toes up, hold it, and tap twice. Lift, hold. Good job. Now let's add the hands. Lift and hold it, and tap twice. Again, lift them up, hold, tap twice. One more set here. Now, I want you to follow your hand with your eyes. This hand starts here. This is the hand you'll be following with your eyes. Take it up slowly. Keep your eyes right on those fingers. And as they come down, slowly bring the hand up, still keeping your gaze right there. Take your time. And we'll do it again. Take a deep breath in. Don't stop breathing. I know sometimes when you concentrate, we do stop our breath, or we breathe very shallow. Keep your eyes on those fingers. That's the important part. Now, if you can, and if it's comfortable, you can take that hand up just a little bit higher. But if you need to stay at the same level, that's okay. Bring it up. And now, put your hands together and let's do a little wave and take it over to this side. This hand is out. Touch. All right, do the same thing here, keeping your gaze right on those fingers as it comes down and then slowly up. Remember, if this exercise makes you dizzy, stop the exercise. Let's do it again. Big breath in and slowly breathe out. And back up again. Okay, you have one more to go here. This is hard to keep focusing, isn't it? It takes practice. Let's take it up again. And now here's your change. You're going to take this hand up, bring it slowly down toward your knee, but I want you to keep your eyes on those fingers. And then bring it up. We're going to do that again. Take your time. Can you do it one more time? This is the last one for this side. Slow and easy. And now, we're going to use the other hand in the same way. Take it up to start with. Now, keep your eyes on your hand. Don't look at me. You know the routine here now. Just keeping your eyes fastened right on those fingers. Keep going. Are you breathing? Take a breath in. And breathe out. Okay, this is the last one here. Okay, let's bring your hands up. Take a big breath in. Slowly breathe out through the mouth and relax. Wonderful job. Let's concentrate a little bit more on your breathing. Place your hands together. As you breathe in, the arms are going to go up just a little. And as you breathe out, the arms will come down. Do it again. Big breath in. Let the belly expand. Draw that breath in. And now breathe out through your lips. We'll practice it 2 more times. Breathing in through the nose and out through the lips. Feel the air coming into your chest and then releasing it. Let's look at the shoulder as you lift it. And look at this shoulder as you lift. Now, roll the shoulder forward, up and back. The other shoulder forward, up and back. Point your elbow to the back of your chair, and this elbow points back. Now squeeze your shoulder blades, and let's do it all again. Lifting the shoulder twice, and the other shoulder, looking at it if you can. And now rolling the shoulder forward, up, pull it back, and the other shoulder. Good job. Now, point your elbow to the back and the other elbow to the back. Squeeze those shoulder blades. And now we're going to do that all again. Lift the shoulder twice. And roll the shoulder. This time, if you can take the arm up just a little bit as you roll the shoulder forward, up, and back. Now squeeze those shoulder blades. And let's get ready to turn, hooking one arm over the chair and reaching across. Lengthen your spine. Look to the side. Now keep that nice pose and just turn your head so you're looking right at me. And we're going to do it again. Reach across, and if you cannot put your arm over the back of your chair, just hold here. Look to the side. Hold that nice pose and turn your head so you're looking at me. Take a breath in. And as you breathe out, push the air out with your hands. Breathe in and draw that air in. Again, breathe out and pull it in. One more time. Breathe out and in. Okay, let's do a heel and toe. And circle your ankle. And are you ready to change? Put this foot down, heel and toe, heel and toe. Ready to circle your ankle? Big circle with the toes. Pretend you're outlining a clock with your toes. Now place that foot down. Take a deep breath in. Let the belly expand. And slowly breathe out. Great job. Let's keep moving. Start by tapping your toes. Now we're going to add some hands, so get ready. Here we go. We'll begin by holding the chair and pushing the palm down. Hold this side now and push on this hand. Feel your shoulder pulling down. Okay, hold your chair, shift your weight just slightly. push the palm down as though you're pushing the floor away. Here's your last one. Pretend you're sitting on a clock. Shift your weight all the way around the numbers on that clock. And now reverse the direction. Okay. Now you're going to shift your weight slightly forward, gripping your toes to the floor, and shift back, lifting your toes. Forward, grip the toes, and back. Lift up the toes. Forward and back. Ready to trace that clock again? Push down hard on each number. You may even have to lift a hip a little bit. And reverse that direction. Okay, we're going to do a seat lift now. You want your feet up about shoulder width apart, holding onto your chair. Your chest is lifted and your chin is lifted. Okay, ready? You're going to lean forward, up, and lift. Take a deep breath now. I want you to do that again. Big breath in, breathe out as you push up and lift and back down. You want to lift just a little bit. Lean forward slightly. Chins and chest up. Push down through the heels and back. Okay, one more time. Take a breath in. You can do it. Lift, pushing the heels. There you go. Now hold to the chair and reach to the side. Bring your arm down and sit up nice and tall. Hold your chair. Remember, don't lean out too far. Bring the arm down. And now we're going to do it again, but you're going to start with the arm down, going up shoulder level and bringing that arm back down again. Sit up tall. Now shift your weight just slightly. Don't lean too far. Okay. We're going to stand up now, so make sure your feet are wide apart, your chest is lifted, chin is lifted, and you're holding that chair. We'll start with your seat lift. Take a breath in, and up, and down. Now, this next time we're going to come halfway up. Take a breath in first. Slowly breathe out. Don't forget to hold your chair. Come halfway up, and down. Now we're going to go all the way up. Great job. The last routines will be done standing, so I want you to walk carefully to the back of your chair, making sure the chair is steady and doesn't move. The back of your chair should be high enough so that you can rest your hands comfortably on the back of the chair. Start by doing these exercises with both hands touching the back of your chair for support. Over time, as you begin to feel more confident, you can progress from both hands on the chair to fingertips only. And when that gets easy, try using only one hand on the chair with your fingertips barely touching. Now, stop if you feel dizzy, and if you begin to feel unsteady, hold onto the chair, widen your base of support, focus your eyes forward, and move slower. If you can't stand, try to adapt this routine from your sitting position. Now, let's get into good standing posture. Stand a bit away from the back of your chair, but close enough that you can easily touch it for support. Feet are hip width apart, and your weight should be evenly distributed over both feet. Relax your shoulders, stand up tall, and look straight ahead. And don't forget to breathe. Take a deep breath in, and breathe out. Lift up on the toes, and drop to the heels. Let's do it again. Up on your toes, keep moving, and down on the heels. Now, lift one heel, and then bring it down. You're bending right here across the toes. And again, lift up, and down. Lift, put some weight over those toes, and down. Now we're about to do a side leg lift, so I want you to get your feet wide apart, just hip width apart, and don't lean. Just lift as high as you can. We're going to do about 6 of these, so take a break if you need to, and just do the best you can. I think you have about 2 more to go. Okay, now reposition. Make sure your feet are hip width apart, your weight is shifted to this leg. Stand up tall and don't lean. Here we go. Let's lift. Up and down. Remember, you don't have to lift very far. Just do the best you can. You have about 2 more here. Okay, ready for that heel lift. Check your posture. Lift up the heel and bend across your toes. And then drop the heel. Lift and drop. Okay, keep going. You have it. This is your last one. Now, reposition. Get your feet hip-width apart. We're going to do a back leg lift. You're going to touch the leg to the back and then bring it to center. Touch and bring it center. Touch again. Okay, shift your weight to this leg now and touch the other leg to the back. Touch back. Touch. Keep your chins and chests up. And remember to breathe. Touch. Okay. Now we're going to just bend the knees and straighten. Come up on your toes and down. Super job. Okay, we're going to be challenging your balance even more now. So do the best you can. Start with good posture. Feet hip-width apart. Tailbone tucked under. Ribcage lifted up. You're looking straight ahead and you're smiling, right? Okay, here we go. You're going to reach out for that imaginary chair with your hips. And then as you come up, you're going to squeeze the buttocks together. Good job. Take a breath. Breathe out. We're going to do that again. Now, if your knees hurt, when you do this, just don't do this exercise. Reach out with your hips and squeeze back up. Now, we're going to get ready for the next movement. You're going to shift your weight to this foot, and we'll touch the foot front and coming back to center. Touch to the side and back to center. Touch to the back and to center. Now, your feet are apart. You're shifting your weight here, and we'll do it all again with this foot. Take it to the side. Stand tall. Take it to the back. Okay, let's shift your weight here. Touch it front and center. Notice how this leg is helping you to balance. Touch to the back and then shift your weight to this leg. Just one more set here. Now to the side and to the back. Okay, let's regain that good posture if you lost it. Everything is lifted up. We're actually going to step to the front and then come back to center. We'll step to the side and back to center. Step back and to center. Now shift your weight to this leg and step front. Come back to center, to the side and center, and just step softly back and center. Okay, shift that weight again. We're going to do it all again. Stepping, coming back to center, stepping side, back to center, lengthen your body, and step back and center. Now, readjust your posture, weights on this leg, and step forward. Come back to center, and to the side, and now to the back. Okay, a little more of a challenge coming up, so readjust your posture. Make sure you're in perfect standing position. We're going to just step front and now go directly to the side and directly to the back. And then get the feet hip-width apart, step front, step side, and step back. And feet hip-width apart. We're going to do it all again. Front and side and back. All the weights here. Let's go front and side and to the back. Okay, let's check that posture. Feet hip-width apart, Ribs are lifted, chest and shins are back. Take a deep breath in and slowly breathe out. Okay, we're just going to move right on here. The last part of the workout is more challenging. If you were able to do the standing portion with one hand lightly touching the chair, then you may want to try it. If you are still exercising with both hands on the chair, stop the video now and keep practicing. In time, you may be ready for the next step. If you do continue, be sure to watch it first to decide if you're ready. For your safety, it is always advisable to learn these exercises in the company of another adult. Let's challenge your balance just a bit more. Get into good posture, chest and chins up, take a deep breath in, feet are hip-width apart. Let's go. We're going to start by lunging to the side. You're going to take a small lunge, so put your weight on this leg and lunge out to the side just with a small step, and then come back. Lunge to this side and come back. We'll do it again. Another lunge here and one more on this side. Okay, we're going to make it even more challenging. If you can, after you lunge to the side, I want you to reach out with the arm. Come back. And let's do it on the other side. Lunge and reach out. Come on back. Okay, take a breath. And breathe out slowly. Lunge to the side one more time and reach. Bring that foot back in and lunge to this side one more time and reach. Okay, now we're going to start marching. Lifting just a little bit at first. All right, now let's add to that challenge a little bit. Weight is here, and you're standing on one foot. This is a very slow march. Step on this foot and lift this one. And step and lift. Lift. Okay, let's do about 4 more. Shift your weight, stand as tall as you can. Remember that string pulling you up to the ceiling? I want you to feel it from the top of your head. This is your last one. Okay, now check your posture and come up on your toes, straight up. Tighten the abdominal muscles, tighten the buttocks, and then come back down softly. Take a deep breath in and slowly breathe out and come way up on those toes, up on the balls of your feet, and slowly down. Okay, we're going to do it about 2 more times. Come on up and down. Here's your last one. Make it the best. Can you feel those calf muscles tightening as you come up? They're working hard. And come back down. And now let's stretch out the calf muscles. 1 step forward, 1 step back. Make it a wide base of support so that only your forward knee is bent. Your back leg is straight, and you should be feeling that stretch right in the back of your lower leg. That's your calf muscle. Bring your feet together. Take 1 step back with the other foot and 1 step forward. Knee is right over your ankle, back leg is straight, your chest is up and your chin is up, and you're smiling, right? Okay, keep going. Feel that stretch. All right, we're going to do 2 more, 1 on each side. 1 step forward, 1 step back. Make sure only this front knee is bent. Back leg needs to be straight to feel that stretch. Okay, let's bring your feet together and step back and step forward. Now, if your feet are not wide enough apart or your toes are not pointed forward, you may not feel the stretch. You can lean a little bit into your chair to feel that stretch. And then come back. Bring your feet together. Take a deep breath in, and breathe out. Great job. If you found this workout challenging today, don't be discouraged. Keep trying. With practice, you'll be surprised by how much more you can do. If, on the other hand, you found the beginning level workout too easy, you are ready to move up to the next Sit and Be Fit balance and fall prevention workout. Regardless of your fitness level, proper and regular exercise will help you feel and function better. So keep reaching out with me for a better day.
For information on DVDs, videos, and audio tapes, including specialty videos for chronic conditions such as arthritis, or for a complimentary copy of the Sit and Be Fit newsletter, please write Sit and Be Fit, P.O. Box 8033, Spokane, Washington 99203-0033, or call 509-448-9438, or visit us on our website at sitandbefit.org.
This program is a collaborative effort of Sit and Be Fit, Stanford University Medical Center's Trauma and Emergency Services, Sequoia Hospital, and the San Mateo County Fall Prevention Task Force. Special funding provided by Stanford University Medical Center, San Mateo County Aging and Adult Services, and Catholic Healthcare West's Community Grants Program. Earlier today, senior fitness expert Dr. Carl Knopf dropped by the studio and shared some important tips relating to fall prevention. Let's take a look. Welcome, Carl. What kind of fall prevention tips do you give to your clients and students?
Marianne, I always tell my students you don't want to fall into poor health, and if they can commit to an ongoing exercise program and follow the simple tips that we're going to discuss today, that's a great way to start.
What kind of tips?
First and foremost, make sure that home is as safe as it can be.
Have any ideas on how to do that?
Well, many falls occur in the bathroom, so if they can think about adding grab bars for support, and remember, towel bars are made for towels, not for holding people up.
And how can we avoid tripping?
Get up slowly from sitting or lying down. Don't rush to answer the phone or the doorbell. Improve lighting in and around the home by adding night lights, increasing bulb wattage, and keep pathways free of obstacles and clutter, and get rid of those throw rugs.
What else can we do around the home?
Arrange cabinets and closets so that things that you use most often are within easy reach. And remember, chairs are not to be used as step stools.
And recommendations for shoes?
Make sure all your shoes have non-slip thin soles.
What about medications? Any complications there?
Marianne, that's a super point. It's also important to review your medications with your doctor. Sometimes drug combinations can increase your risk of falling. Many times the medications you're taking cause you to get lightheaded, and thus you fall. Also, another good idea, Marianne, is to have your glasses and vision checked regularly.
And what about exercise?
That's our thing, isn't it?
It is.
The important thing is to make sure that it's a comprehensive program. It's got to include balance, strength training, and mobility training. And most of all, make sure you check with the doctor to make sure you got their approval.
And I think it's a good idea to call a friend before and after exercising, just to check in.
That's a great point.
Yeah. Well, Carl, those are great tips. Thank you so much for coming by.
The pleasure's all mine.